Hi, and welcome to the Stuff You Should Think About. I'm your host, G, and today's episode is going to be about lobotomies. When we talk about lobotomies, we're talking about one of the most sobering chapters in the history of medicine. A moment when human curiosity, desperation, and limited understanding collided in a way that reshaped thousands of lives. And to understand how lobotomies came to be, and why they were once considered a miracle cure, we have to zoom out, widen the frame, and look at the human brain not as a simple organ, but as the most complex structure we know of in the universe. Let's start with the basics. A lobotomy is a surgical procedure that severs connections in the brain's frontal lobes, the region responsible for planning, decision making, personality, and emotional regulation. Today, that sounds unthinkable, but in the early 20th century, mental illness was poorly understood and treatments were limited, often cruel and rarely effective. People were suffering, families were desperate, institutions were overwhelmed, and into that environment stepped a procedure that promised relief. But to understand why anyone thought this was a good idea, we have to zoom into the science of time. Neuroscience was in its infancy. Doctors knew that the frontal lobes played a role in behavior, but they didn't yet grasp the intricate networks that make the brain function. They saw the brain as a series of compartments, each with a specific job. If one compartment malfunctioned, perhaps disconnecting it could quiet the symptoms. It was a simple idea applied to a system that was anything but simple. The first lobotomies were performed in the 1930s. The logic was straightforward. If a patient was overwhelmed by anxiety, delusions, and uncontrollable thoughts, severing the pathway that carried those thoughts might calm the mind. And in some cases, patients did appear calmer afterwards, not because their illness was cured, but because the surgery reduced their emotional range. It muted the mind. It dimmed the lights in the very part of the brain that makes us who we are. Now, let's zoom out again, because the story of lobotomies isn't just medical, it's cultural, it's societal. It's a reflection of how humans respond to the unknown. When we don't understand something, whether it's the cosmos or the mind, we often reach for solutions that feel intuitive, even if they're incomplete. And in the 1940s and 50s, lobotomy spread rapidly. They were performed on tens of thousands of people. Patients with severe mental illness, veterans with trauma, even children with behavioral issues. It was a time when the promise of science outpaced the understanding of science. And here's the cosmic irony: the very organ being operated on, the human brain, is the most complex object we've ever encountered. More complex than any star, any galaxy, any nebula. 100 billion neurons, each with thousands of connections, forming networks that give rise to thought, memory, emotion, and identity. To sever those connections without fully understanding them was like trying to fix a supercomputer with a hammer. But that's how science works sometimes. Not perfectly, not cleanly, through trial, error, and the slow accumulation of knowledge. Lobotomies declined rapidly in the 1950s and 60s with the development of antipsychotic medications and a deeper understanding of brain function. As neuroscience advanced, it became clear that the brain is not a set of isolated compartments, but an interconnected web. Alter one part, and the effects ripple outward. And yet, the story doesn't end there. But even today, we use procedures that echo the logic of lobotomy, but with far more precision. Deep brain stimulation, for example, uses electrodes to modulate neural activity in conditions like Parkinson's disease and severe depression. It's not about severing connections, it's about tuning them, guiding them, working with the brain's natural rhythms instead of cutting them apart. This is the evolution of science, from the blunt instruments to delicate tools, from guesswork to understanding. So, what does the story of lobotomies teach us? It teaches humility. It teaches that even with the best intentions, we can make profound mistakes when we don't fully understand the systems we're trying to fix. It teaches that the brain, this 3-pound organ made of atoms forged in ancient stars, deserves our deepest respect. And it teaches that progress is not a straight line, it's a winding path, shaped by curiosity, error, discovery, and the relentless human desire to alleviate suffering. In the end, lobotomies remind us that science is a journey toward understanding the most complex object the universe has ever assembled, and every step, even the missteps, bring us closer to truth.